In this video by DeckPlate, we will understand the VA ratings for amyotrophic lateral sclerosis, multiple sclerosis, meningitis, cerebrospinal, epidemic, abscess of brain, malignant, benign, progressive muscular atrophy, Syringomyelia, and Myasthenia Gravis. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Neurological conditions have specific criteria that determine the level of benefits veterans can receive. Understanding these ratings can be crucial for veterans seeking compensation for their service-connected health issues. Amyotrophic lateral sclerosis, diagnostic code 8017. Amyotrophic lateral sclerosis is a progressive neurodegenerative disease affecting nerve cells in the brain and spinal cord, leading to muscle weakness and atrophy. Rating: 100%. Consider the need for special monthly compensation. Multiple sclerosis. Diagnostic code 8018. Multiple sclerosis is a chronic illness involving the central nervous system, where the immune system attacks the protective sheath myelin that covers nerve fibers, causing communication problems between the brain and the rest of the body. Minimum rating: 30%. Meningitis, cerebrospinal, epidemic, diagnostic code 8019. It is an inflammation of the protective membranes covering the brain and spinal cord, which can be caused by infection. As an active febrile disease, rating: 100%. Rate residuals, minimum 10%. Abscess of brain. Diagnostic code 8020. A brain abscess is a collection of pus that develops in response to an infection or injury. As an active disease, rating: 100%. Rate residuals, minimum 10%. Spinal cord. New growths of. These are tumors or new growths in the spinal cord, which can be either malignant or benign. Malignant, diagnostic code 8021. Rating: 100% for 2 years following cessation of treatment. If residuals stabilize, rate on neurological residuals based on symptoms. Minimum rating thereafter: 30%. Benign, diagnostic code 8022. Minimum rating: 60%. Rate residuals, minimum 10%. Progressive muscular atrophy, diagnostic code 8023. This condition involves the progressive wasting away of muscle tissue due to degeneration of nerve cells. Minimum rating: 30%. Syringomyelia. Diagnostic code 8024. Syringomyelia is a disorder in which a cyst forms within the spinal cord, potentially leading to progressive weakness and stiffness. Minimum rating: 30%. Myasthenia Gravis. Diagnostic code 8025. Myasthenia Gravis is a chronic autoimmune disorder causing weakness in the skeletal muscles, which are responsible for breathing and moving parts of the body. Minimum rating: 30%. Important note on minimum ratings. For all the conditions under diagnostic codes 8000 to 8025, the VA requires that there be ascertainable residuals. This means that the symptoms must be objectively verifiable, such as headaches, dizziness, or fatigue. Subjective residuals are accepted when consistent with the disease, and not more likely attributable to another condition. When assigning ratings higher than the minimum, the specific diagnostic codes used for evaluation must be cited along with the codes identifying the diagnoses. Thank you for watching this video. Please don't forget to subscribe and like our videos.